So, hi, this is Dr. Don Buford. I'm here with one of my patients, long-time patient, although we haven't seen each other for a while. My friend here had a left shoulder rotator cuff tear that we fixed 16 years ago now. And it was at the time it was a full thickness tear. We put in 2 metal suture anchors, and we put in 1 suture anchor to fix the biceps tendon because he had what was called a slap lesion. And so he's in today primarily because of the right shoulder. But it's nice because it gives us a chance to follow up on the left shoulder. Let me see, just raise that left arm up, then behind your head and out to the front. Have you had any problems with the left shoulder over the years, or have things been pretty normal for you? Tell me about your activities. What sorts of things do you like to do recreationally?
Play tennis. I'm left-handed, and so one of the things I did was extra therapy in order to be able to play tennis again.
So you've been playing tennis on that side?
Yes.
In 4.0, 4.5 level, I'm guessing, winning tournaments?
4.0, yes.
All right, good deal. Thank you very much.